New York State does require that all residents of skilled nursing facilities receive dental care. And they are free to select how that dental care is delivered. They can make arrangements to transport the patients, or they can make arrangements for a dentist such as myself to come into the facility and treat them there.
Just like the traveling medicine man, Dr. Albert Cantos performs a Mohammed to the mountain routine by bringing his dental expertise to shut-in nursing home patients, many of whom hadn't seen a dentist in years. Dr. Cantos, who has his own private practice in downtown Buffalo and is involved in research projects at the University of Buffalo, specializes in geriatric dentistry. Where do you treat your patients in a nursing home? What kind of a setup do you have? There's no dental office.
No, it varies depending on the facility. From a clean utility room, which is a room which is also used when I'm not there by the podiatrist or the optometrist or the physician for examinations. It's also used for grooming in some cases. In other facilities, I use the beauty shop. When I'm not there, people's hair is done. In fact, sometimes when people are wheeled into the dental office, they're expecting to get their toenails clipped or their hair done. And I have to convince them that that's not what they're there for that day.
Who pays for all this service? How is that taken care of?
Most of the residents in skilled nursing facilities eventually are covered by Medicaid. In the nursing facilities, I am paid by the nursing home for the care of all of those patients that are covered by Medicaid. If a patient isn't covered by Medicaid, then I do make arrangements with the family.
Tell me about geriatric dentistry. What kind of problems are prevalent?
Well, what we see in the elderly population that we don't see in the younger populations in general are a drier mouth because of blood pressure medications and other medications that they're on, and much higher prevalence of periodontal disease, and we have exposed roots. There's a number of people that have been wearing dentures for a long time, and after a certain period of time, it becomes difficult for people to wear a denture as they lose bone that supports the denture. Okay. How long has it been since you met with a dentist?
Oh, it's been a couple of years.
In a couple of years? Are you having any problems with your mouth, chewing your food?
Yes, the first ones I bought were beautiful.
Your first dentures?
Yes.
And you wore those for quite a while?
I got lost, and then they had some made, but they never were.
You had a second set made?
Right.
And they didn't fit right? What we'll do is next time I see you, we'll take some impressions. Okay. I'd like you to bring your other dentures with you, though.
Okay.
Okay? When I first started going to nursing homes about 6 years ago, on my first visit, I was often greeted with a tray of about 30 dentures, and we didn't know whose dentures they were. What we do is we indelibly apply a patient's name to their dentures, and with a lacquer that is manufactured for use in the mouth, but I would compare it to a clear nail polish. We have no difficulty in identifying whose dentures they are.
Any special concerns for the infirm elderly dental patients?
Well, the decision is always difficult as to what point the patient is actually deriving a benefit from dental care and at what point it's a greater invasion. And that is the real difficult question that makes up the specialty of geriatric dentistry. In some cases, we will not treat a patient, even though they're in need of multiple fillings or extractions. And the decision to not do that is one that is a difficult one to make. We often make it with consultation with the family and with the physician, and that's one that more research is required to help us come up with the answers for that.
What you're saying, and there are ethical issues that do surface, in the practice.
Yes, there are a considerable number of ethical issues involving whether to treat or not to treat, and whether to overrule a patient's wishes when they're somewhat confused. And we try not to take a parental type attitude where we always feel that we know what's best for the patient. On the other hand, there are instances where the patient's decisions are really contrary to their own best interest, and that's where the ethical decision is weighs very heavy on us. How does it feel? Mouth feel a lot cleaner?
Yes, it does. This will be a horrible film. We'll probably have to let your teeth get.
And when was the last time you got out to see a dentist?
Oh, ages, unfortunately.
So what do you think of the idea of the dentist coming here?
It's a good idea. really. And if I'd have had somebody to do that for me sooner, my teeth might not have been in the shape they're in.
But at least you know that you're going to get some good dental care.
Right, yeah.
Well, we could see many advantages in such a service. Are there any disadvantages?
Well, the obvious is that I don't have the backup of equipment that I would prefer to have as I do in my dental office. And as a result, there are procedures which I do not provide for these patients. The ability to follow patients on a day-to-day basis is also difficult to do, whereas sometimes if a patient is admitted to the hospital, we can watch them day-to-day. And when people ask about geriatrics, if somebody is 95 years old and comes walking into my office with a bounce in his step, I'll often treat that person pretty similarly to I will a 20-year-old. But when somebody is infirm on multiple medications, then there are a lot of differences. It's something that is very satisfying, and I think they appreciate it. And open real big. I feel very good about dentistry as a result. It's broken up the monotony of just an office practice, and I feel like I'm really accomplishing something.
It's very nice to have them taken care of. I feel much better.